Surgical asepsis, or sterile technique, refers to the activities that make and keep an area or an item free of microorganisms. Items and equipment are sterilized by dry or wet heat, radiation, or chemicals. Surgical asepsis includes handling sterilized items and equipment properly. Hand washing, wearing protective clothing such as gloves, gowns, masks, caps, and eyewear, and setting up and maintaining a sterile field. Surgical asepsis is used during surgical and invasive procedures, and when working with clients whose skin integrity is interrupted. Establishing a sterile field will be your responsibility. You'll check the provider's orders and the institution's policy to determine whether or not a procedure requires surgical asepsis. In many cases, the institution will have assembled packages designated for specific procedures and will have sterilized them. These packages contain the items commonly used for that particular procedure. Procedure-specific packages can also be purchased. In either case, you'll check all sterilized items and packages for any signs of moisture, interruptions in the packaging, a current expiration date, chemical indicators, and discoloration of the packaging. If any of these things are questionable, the contents might be contaminated. Assume that the package is not sterile and do not use it. Some general principles you must understand before you set up a sterile field are: once the field is set up, do not turn your back to it or leave it unattended. Keep all sterile items at waist level or higher. All items in the sterile field must be sterile. Sterile tables and drapes are only considered sterile at the surface level. The outer portion of a sterile field, about 1 inch, that's 2.5 centimeters from the edges, is considered unsterile. The field is no longer sterile if it becomes wet, unless there is a waterproof barrier under it. And finally, all sterile items must be handled with sterile gloves or sterile forceps. Items are no longer sterile after prolonged exposure to air, when touched by non-sterile items, and once they have been out of your line of vision or below waist level. One more precaution. Honesty is vital when using a sterile field. Any person who sees the sterile field or any component become contaminated or sterile technique broken is responsible for taking corrective action. Now let's go ahead and demonstrate setting up a sterile field. We'll assume the nurse has checked the provider's orders, examined the sterile packages for signs of contamination, and reviewed the institution's protocols for the procedure. When setting up a sterile field, the nurse first drapes the sterile field by opening the package and letting the edges of the wrapping drop down and away. She is careful to touch only the outside surface of the drape. If she adds additional items to the field, she must be careful not to reach across the field. She opens the additional items and carefully drops them onto the field. She must not allow the packaging to touch the sterile field. She opens packages away from the field to avoid contamination. Next, the nurse prepares a sterile antiseptic solution. She reads the label 3 times to be absolutely certain that it is the correct solution and strength, and that the product has not expired. She removes the lid and places it sterile side up on a clean surface. With the bottle in the palm of her hand and 4 to 6 inches above the bowl or other container in the sterile field, she carefully pours the liquid. She makes every effort to avoid splashing it. She recaps the bottle and follows the institution's policies for labeling it with the date and time of use and any other required information. Next, she will put on sterile gloves using the open gloving technique. She washes her hands, then opens and removes the outer packaging of the gloves. She places the inner packaging on a clean, dry surface. Identifying the right and left glove, she prepares to glove her dominant hand first. She grasps the glove by the cuff with a thumb and the first 2 fingers of her non-dominant hand, touching only the inside of the glove and keeping her thumb against her palm. She inserts her dominant hand into the glove. She pulls the glove on gently. Then, with her gloved hand, she inserts her fingers under the cuff of the second glove. With her thumb against her palm, she inserts her non-dominant hand into the glove and gently pulls the glove onto her hand. She keeps the thumb of her dominant hand as far from the palm as possible when putting on the second glove. Now let's suppose that the closed gloving technique is required. This is done when a sterile gown is also required during surgery, for example. The nurse opens the sterile glove package and carefully drops the inner package on a sterile surface. She then opens the gown packaging and places the inner package on a clean surface. She performs surgical hand washing, then approaches the gown. It is folded inside out, so she grasps the gown at the crease near the neck, steps back from any objects, and allows the gown to unfold in front of her without coming in contact with any surfaces or objects. With her hands at shoulder level, she places her hands inside the shoulders of the gown and works her arms down the sleeves. She makes sure she doesn't push her hands outside of the sleeves. Another masked and gloved staff member pulls the gown around her and over her shoulders and ties it. With her hands inside the sterile gown, she opens the inner packaging of the gloves on the sterile gown field. Using her non-dominant hand, which is still inside the sleeve, she picks up the glove for her dominant hand by its cuff and lays it on her dominant forearm. Note that the fingers point toward the elbow, with the palm of the glove over the palm of her sleeved hand. She gloves the dominant hand while still sleeved, making certain that the cuff of the glove is above the cuff of her gown. She will then repeat the procedure for her non-dominant hand. Note also that only the front waist to shoulder area and the cuffs up to 2 inches or 5 centimeters above the elbow are considered sterile on a sterile gown. And once you put on the sterile gloves, you must keep your hands above your waist and in front of you, and they must only touch sterile items. You will use these gowning and gloving procedures anytime surgical asepsis is required. You must be familiar with your institution's protocols for any procedures that require a gown, gloves, eyewear, or a mask. Proper sterile technique protects your clients from exposure to contamination that could have dire consequences for them.